Everyone, today we are going to discuss about disaster management. First of all, introduction of disaster management. Disaster management is the systematic process of planning, organizing, coordinating, and implementing the measures to prevent and prepare for, then respond to and recover from the disasters. It aims to reduce the loss of life, then property and environment damage while ensuring safety and well-being of affected communities. Then disaster may be natural such as earthquakes, floods, cyclones and droughts, or human-made such as industrial accidents, fire, chemical spills and terrorist attacks. Effective disaster management involves the coordinated efforts of government agencies, healthcare professionals, emergency services, and non-governmental organizations. Then, definition of disaster management. Disasters is any occurrence that cause damage, ecological disruption, and loss of human life or deterioration of health and health service on the scale sufficient to warrant an extraordinary response from outside the affected community or area. Then the types of disaster. First one, natural disaster. Natural disasters include earthquakes, tsunami, droughts, forest fires, landslide and mudslide, floods and volcanic disruptions. And then the another type is man-made disaster. It included hazardous substance accidents, examples chemical toxins, gases, radiological accident, dam failures, resource shortage. Examples like food, electricity and water, the structural fire and explosion and domestic disturbances. Example like terrorism, bombing and riots and bioterrorism. Exhalation. Then fire and toxic materials, pollution, civils unrest, terrorist attack. These are the man-made disasters are included. Throughout the history, natural and man-made disasters have disrupted food and water supply, causing communicable disease, injury, illness and death. Then major natural disasters are flood, cyclone, drought. Man-made disasters are deforestation, pollution, chemical pollution. Then wars. Minor man-made disasters is road or train accidents, food poisoning, industrial disasters, environmental pollution. Epidemiology. Epidemiology is the primary agents of including the falling building, heat, wind and rising water and smog. The secondary agents including bacteria, virus that produce contamination or infection after primary agent has caused injury or destruction. Then the disaster management, it include preparedness, response and recovery and mitigation. Then preparedness is active prior to disaster. Examples is plan, emergency exercise, training and warning system. Then response is the activity during disasters. Is examples to public warning systems and emergency operation, search and rescue. Then the recovery is activities following to disasters. Examples like temporary housing, claims processing and grants, long-term medical care and counseling. Then mitigation, activity that reduce the effect of disasters. Examples building codes and vulnerability and the public education. Then we are discussing about the phases of disasters. First one, there are three types of phases. First one, pre-impact phase, then impact phase and post-impact phase. Pre-impact phase is initial phase of disaster. Warning is given prior to actual occurrence. Emergency centers are opened. Communication, radio and television community must be educated. Then impact phase. This occurs at the times of the impact phase until threat of further destructions has passed and emergency plans in effect. Emergency operation centers has been established by physical and psychological support. Post-impact phase means recovery being during the emergency phase and with the return of normal community order functioning. For persons in the impact the area phase may last lifetime. They are victims of the atomic bombing of Hiroshima. Then the disaster recovery, it included flexibility, community cleanup efforts, release of continuing treat, teaching proper hygiene, short-term psychological support, alert of environment health hazard, home visit. Principles of disaster management to prevent the occurrence of disaster whenever possible. First one is minimize the number of casualty if the disaster cannot be prevented. Prevent further casualty from occurring after the initial impact of disaster. First one is rescue the victim and provide first aid to the injured. Evacuate the injured to medical facility. Provide definite medical care, then promote reconstruction of their life. Role of nurses in disaster management. First, diagnose the community and treat the disasters. Then, determine the actual and potential disasters. Treats. The preventing measures is being taken care of. First point is their collaborative activities and undertaken so the people are aware about the community preparedness. Diagnosis community disaster treats. Then determine the actual and potential disaster treats and effective community based disaster plan. Okay, thank you.